All right, hey everyone. My name is Anna Kawakami, and I am a fourth-year PhD student in the School of Computer Science at Carnegie Mellon University, where I specialize in human-computer interaction. Today, I'm really excited to share some work completed in collaboration with my co-authors, Jordan Taylor, Sarah Fox, Haye Zhu, and Ken Holstein. So to give a little bit of context, our research team studies AI deployments in various real-world contexts to inform how we can design new tools that best support more responsible workplace AI design practices. And today, I'm here to present some research that resulted from reflections and discussions across time doing this type of work. So while there's increasing promise of AI deployments transforming the workplace, we often see that workplace AI technologies fail to meaningfully augment worker skills in practice. For example, in social services, AI-based decision support tools have been introduced for high-stakes decisions, only to be dropped following worker backlash. And in healthcare, researchers have developed AI-based tools to support clinical decision-making, only to find that clinicians ignore them in practice. And researchers have advanced an understanding of why exactly AI systems might fail to augment worker practices. For example, AI tools might lack validity and not do what they purport to do. They might also simply fail to fit into workers' decision processes or embed inappropriate assumptions about or misaligned values with workers. And while prior work has surfaced these designing and modeling challenges across many domains, if we center the workers and the ways in which their labor is societally perceived and valued, it becomes clear that the type of labor these professions center on are quite different from each other. Occupations like home health care, social work, and K-12 teaching are all examples of historically devalued occupations in the United States. And these are actually distinctions that have been well studied in academic circles like economics, sociology, women's and gender studies, and psychology. But when it comes to AI design and evaluation, there's been less discussion about how gendered interpretation of human labor impacts AI development and deployment practices on the ground. And so in this paper, we'll examine how the devaluation of worker expertise contributes to AI failures and vice versa, to inform how we can design towards a pro-worker future for AI and society. And in particular, we're going to ground our study in past AI deployments across 3 domains of feminized labor, including K-12 teaching, home health, and social work. Feminized occupations typically involve emotional and care-oriented labor, and provide a particularly striking example of devalued expertise. And today, feminized labor continues to be predominantly performed by women and people of color who often occupy low-status positions in their organizations. And in these occupations, workers have been documented to describe that they often feel like their expertise is misunderstood by higher-status workers in their organizations. Historically, many feminized occupations have been envisioned to be automated away with new technological innovations. For example, in this 1961 print, we see a picture of a classroom filled with students and computers, but no teacher in sight. It depicts a prediction that half of all students will use teaching machines, also referred to as robot teachers. In contrast to these hopeful visions, research around the impact of new AI technologies on the labor market has often suggested that many forms of feminized labor make up some of the most automation-proof occupations today. In other words, in the coming years, it'll become increasingly critical to design AI technologies that truly augment and complement worker expertise in these settings. So today, with the explosion of new AI capabilities, we see renewed excitement around the potential of new AI deployments in feminized occupations. And there indeed really continues to be an important design opportunity to leverage AI to better support workers in these domains. But with the rush to deploy new technologies, there's also a big risk of further harming devalued occupations. What can we learn from past cases of AI deployments in these workplace contexts to understand how we can steer the trajectory towards a future where AI deployments that augment and enhance worker capabilities is the norm? So to better understand how the devaluation of worker expertise shapes AI failures, we examined 3 settings that our team has extensive direct research and design experience in: AI-based risk assessment tools and social work, AI-based tutoring systems and K-12 teaching, and care robots in home health care. We conducted a comparative case analysis of AI deployments across these three settings based on a review of prior academic and grade literature in these domains. You can find more details on our methods in our paper. And through our analysis, we first introduced the concept of AI failure loops. AI failure loops are negative feedback loops that occur when the devaluation of worker expertise introduces or reinforces threats to the creation of useful worker-facing AI tools, in turn leading to the deployment of worker-facing AI tools that further amplify harms from worker devaluation. And through our analysis of existing literature, we consolidate 6 interwoven AI failure modes that make visible the mechanisms by which this can happen. So each of these failure modes can occur along various points of the ML development pipeline, from the AI problem formulation stage to AI governance. And as illustrated by this web, the 6 failure modes are mutually reinforcing, where the presence of one failure mode can amplify the likelihood of others. For example, in the social work case study, AI developers began with a misunderstanding about how social workers were making child maltreatment screening decisions. And this understanding wasn't corrected when they were designing a new AI tool that intended to assist these screening decisions because workers themselves weren't involved in the design process. And this also led to the use of AI evaluation measures that were fundamentally misaligned with workers' decision-making goals. And in the home healthcare case study, we found that home health aides were also systematically excluded from the design of new technologies. While clinical decision-making is an inherently collaborative process involving doctors, nurses, and health aides, most existing AI technologies intended to support clinical decisions are designed exclusively for doctors' use. And while there's great investments into innovating AI for healthcare, almost none of these investments are directed towards technologies that intend to assist and augment health aides. We found that this is in part because workers are made invisible by organizational leaders who didn't perceive them to be an integral part of the healthcare system. And instead, other higher status healthcare professionals' needs and goals were prioritized in design efforts, leading to a systematic lack of technologies that augment health aides' work. So on the other hand, there's large investments into technologies that intend to automate home health aides tasks, for example, through new care robots deployed to elderly homes. But researchers conducting a review of the deployments of care robots concluded that the effectiveness of robots is mixed at best. And in fact, care robots have been found to increase home health aides' workload and decrease their job satisfaction. And finally, in the K-12 teaching case study, we saw that teachers' exclusion from adoption decisions of new AIED technologies disincentivized AI developers from understanding teachers' work practices, further challenging their ability to design the AI tools that effectively complements them. When the technologies deployed to the classroom fell short of achieving their envisioned potential, AI developers and school districts often attributed these shortcomings to teachers' purported incompetence with inadequate consideration for potential technology design issues. So overall, these trends contrast from what we might see in technologies designed for forms of labor that have been more societally and historically valued. For example, in the design of healthcare applications for doctors, it's common practice to consult doctors while developing new AI-based tools for them. For decades, doctors have been documented to simply ignore AI-based decision support tools, and we believe that this power to refuse technology use also incentivized researchers and developers to consult them when creating new technologies. So for today's talk, I prioritize giving really brief examples just for the purpose of helping to ground an understanding of the failure modes. But if you're interested in learning about these deeper stories and trends and analyses within each of these case studies, I invite you to check out the full paper. So to recap, to understand the interplay between the devaluation of worker expertise and AI deployment failures, we introduced the concept of AI failure modes, or AI failure loops. And AI failure loops are negative feedback loops that occur when the devaluation of worker expertise introduces or reinforces threats to the creation of useful worker-facing AI tools. We introduced 6 failure modes that help make visible the mechanisms by which this can happen. And tendencies to fall into these failure modes can in turn lead to the deployment of worker-facing AI tools that further amplify harms from worker devaluation. For example, by making worker skills and expertise even less visible to AI developers and organizational leaders. Overall, AI failure loops arise at the confluence of two dynamics: overconfidence in AI capabilities on one hand, and underconfidence in AI capabilities on the other. Moreover, while the tendency to misconceptualize worker expertise in AI development has been documented across many domains, for example, even in AI designed for clinicians, we argue that workers performing societally devalued labor are particularly susceptible to AI failure loops due to stronger existing systems and practices that devalue worker expertise. So as feminized labor becomes increasingly valuable in our society, it's critical that we move towards normalizing AI practices that can truly uplift and enhance worker skills and expertise. Moreover, we believe that a future where devalued expertise is elevated and celebrated through AI is also a future that benefits all workers and society at large, very similar to the curb cut effect talked about in the disability literature. So we align with past calls that we really need to increase research and design efforts towards pro-worker AI futures. But our findings suggest that this alone won't be enough. Workers must be involved as expert collaborators in defining what pro-worker AI should look like. And in our paper, we discuss implications for future research, design, and policy. For this talk, I'll sample a few of these. First, when studying the current impacts of AI deployments on workers, workers themselves should be engaged in defining what complementary AI should look like and how to capture progress towards achieving it. As we saw in the case studies, in many AI deployment settings, workers are often not considered or involved at all in decisions about what and how to measure. In cases where workers are involved, they might be engaged in brief consultations about which high-level concepts an AI system should aim to improve, like predicting patient risks. But they're still commonly left out of the conversation when it comes to how to measure these concepts in light of practical constraints like data availability. For example, what constitutes risk and which outcomes should we use to measure in a valid way? Additionally, existing measurement instruments that evaluate the quality of worker-facing AI deployments often solely focus on worker AI task performance. Other factors, like the impact of AI on workers' well-being or any other additional labor that the AI deployment requires to operate, are often not considered. Second, closely collaborate with workers themselves when designing new AI applications for workplace contexts. And more importantly, when thinking about which workers to work with, think carefully about which stakeholders are most critical to involve. For example, in the social work case study, we saw that social work academics were actually involved, while social workers at the front line, where the AI technology was going to be deployed, were excluded. Social workers on the front line bring in deep experiential expertise and situated tacit knowledge built up from years working on the ground, which is different than the scholarly expertise that the academics bring in. And rather than excluding worker involvement to after an AI model is already developed, proactively involve workers from the earliest stages of AI design, for example, to shape the problem formulation of a new AI tool. And finally, we also agree with existing calls to fund more research on supporting worker AI complementarity. And in addition to this, we also call for greater funding towards research on supporting participatory approaches to designing worker complementary AI with requirements to directly collaborate with workers to develop these approaches. And in some of our ongoing research, I've started to move along some of these paths forward, although there's definitely much more to be done. For example, in collaboration with 4 public sector human service agencies across the United States, we developed the Situ AI Guidebook, a toolkit to support public sector agencies in deeply engaging with frontline workers through deliberation-based workshops to inform early-stage decisions about whether and how to move forward with developing new AI project proposals. I'm also beginning to explore how we can engage with workers in designing new measurement approaches like metrics and benchmarks that evaluate workplace AI systems. And with our collaborators at Microsoft Research, we'll be presenting a tutorial on how we might operationalize AI measurement as a stakeholder-engaged, iterative design process. And you're welcome to join our tutorial, in fact, if you happen to go to conferences like these. OK, thank you so much for listening.
Questions? I'll bring the microphone. No?
No questions. I was a bit, oh, go ahead.
Well, are there questions?
I was just going to say, I was a bit nervous to present this because I think it's a different style and flavor of work than what else has been presented here. But if you have any questions that you want to ask, like off the grid, I'm open after. After that. Okay.
One question is, how is this different, is it materially different from design analysis we've had over the ages where, systems design, computer systems that ignored the line workers, didn't include them in design of a system, forced use. Mm-hmm. Is the use of AI materially different? Is it kind of a continuation of that same issue of getting workers involved? I'm just curious, in your research, did you find any differences specifically related to AI?
Yeah, that's a great question. You're talking about like role-based systems way back in like the early 2000s, 1990s. Yeah, so I think the main difference is just that because the capabilities of AI systems have also increased, people are starting to apply them to an increasingly complex set of tasks. So for example, in the past, we might have thought about how to include technology into like a printing machine or just like very simple forms of decision support, whereas now we're really thinking about like mental health chatbots, for example, like interacting with a person with some need for emotional support and how to provide really contextualized support to them. So I think it's really just the complexity of tasks that we're applying AI to that's the main difference.
And I was wondering if you saw in any of your cases any variation where you perhaps saw kind of different trends or different patterns around worker expertise. And if not, if that might be due in part to the nature of the technologies being used, if they're supposed to be kind of, dispersed widely across different groups, if there's that opportunity for participatory design or having that kind of input. So just curious about those two things, about the kind of variation and the nature of the technologies used across the different cases.
Yeah, that's a great question. So in terms of variation, I think we were focused mostly on analysis of commonalities, but one thing that just stood out to us is that in some industries, it's more common practice to form unions. So workers kind of, form coalitions together and share observations with each other. In social work, this was happening a little bit informally. So the social workers we were talking with and observing their work would kind of like talk to other social workers on the side about observations they had about the AI tool. But in areas like K-12 teaching, teachers actually have unions where they can do this in a more formal manner. And so this kind of changed the level of power they had amongst themselves, and I think that shifted some of the dynamics. In terms of differences based on the type of technology, I guess one clear difference maybe is in the home health care example. We were looking at care robots, where I think in that case, it's a little bit more explicit that the technology is designed to automate their tasks rather than assist them. So if we think about like AI-based decision support tools in social work, the intention really is to assist social workers' decision making. And the robot case, I think maybe for some people the intention is to assist home health aides, but it's kind of a stronger motivation to support patients and people in elderly homes. And so I think that could have also shifted some of the dynamics as well, but that's not really something we look closely into in this paper.
Okay, thank you very much.